We're going to keep the momentum going with our next speaker here, our next presenter. Dr. Anil Nanda will shed light on what clinicians and patients should know as cannabis use becomes more widespread. Dr. Nanda is a board-certified allergist and immunologist in the Dallas-Fort Worth area, an adjunct professor of medicine at the University of Texas Southwestern Medical Center. He recently served as the president of the Texas Allergy, Asthma, and Immunology Society and is actively involved in national committees at both.
And in 2018, there was the Agriculture Improvement Act, which removed hemp from the CSA, basically the drug consortium, legalizing CBD, which we'll talk about if it comes from hemp. And I'll talk about the differences between marijuana and hemp. So state-regulated cannabis programs, this is relatively up-to-date, and it's always changing. There are a few states here that just have a medical-only cannabis program, and then the adult medical, non-medical cannabis program basically means they're legal for recreational use. There's these states here. Again, it started in Colorado and Oregon, and I'm sorry, Washington back in the day. And then some states, including Nebraska, Kansas, and Idaho, at least for right now, don't have any access program at all. And again, politics, it's intertwined in this, unfortunately, and we'll touch on that briefly. So a little bit about cannabis plants from the Cannabaceae family. There's two. There's Cannabis sativa, Cannabis indica. This tends to be, I hear about this, and I don't know if anyone follows like entertainment Hollywood, but it's going, they talk about this, some actors and things, and in the film industry use Cannabis indica. So that's something that they may talk about at the Oscars and different things there. So THC, we talk about THC, right? Delta, you've heard about THC. So it's delta-9 tetrahydrocannabinol, or THC. This is the part of cannabis that produces the psychoactive effects: euphoria, relaxation, delusion, psychosis. It reaches the brain in 30 seconds, so pretty quickly. And this is interesting. Peak concentrations in the blood, 4 to 10 minutes. But this is the takeaway. Psychotropic effects or psychological effects can last up to 2 to 3 hours. Okay, so it's longer lasting. It's about 15% proportion in cannabis, and this is very important. 0.3% THC is a class 1 controlled substance in the U.S. if it's more than 0.3%, and it's called hemp or cannabidiol if it's containing less than 0.3% THC. So the legal part is the less than 0.3% THC. You see dispensaries all around the country. They're again supposed to use less than 0.3%, but we're going to talk about that. It's not very regulated, so be aware of that. So again, I said cannabis plants considered marijuana. Again, that 0.3% if it's higher. Otherwise, it's considered hemp, CBD, less than 0.3%. So these are just helpful for these definitions to help out when people are talking about cannabidiol or THC concentrations. Again, CBD, you see here about CBD oil, CBD products. It's a non-psychoactive cannabis compound found in oils and other products sold online and in retail stores, sold everywhere. And again, it's also called hemp. So some FDA approved uses of marijuana. So, for everything in life, right, including marijuana, there's positives and negatives, right? And so the positives, I'm going to talk about some of the positives of marijuana. Traditional medicine for anything, pain, even asthma, allergy conditions, whatever, it helps, traditional medicine, but it's not perfect, right? That's why we're doing research. That's why we're doing research. Medical research is so important to try and find new uses, new help, especially things like pain and things like that, cancer pain, things like that. So there is a use for marijuana and approved in patients with different conditions, including pain syndromes. So there's positives. It's not just all negatives. For example, dronabinol is a human-made form of THC. It treats nausea and vomiting caused by chemotherapy. It's approved by the FDA. There's nabilone. It's used for treating chemotherapy-induced nausea, vomiting. There's Epidiolex, which is a CBD oral solution approved by the FDA, including pediatric patients for treating epilepsy. So there's some good in marijuana and marijuana compounds. Uses of CBD oil, it can reduce seizures. We talked about managing anxiety. neurodegenerative disorders, pain relief, even acne treatment, some cancer treatments too, at least for the pain, things like that. And a lot of patients, they come, and we'll talk about how to talk to patients and each other about cannabis, just being open. A lot of them are using it because, hey, there's like, hey, doc, my pain from, my back pain, I've had 5 surgeries. It's not helping. I've seen all the different specialists, not helping. This helps me. And that's good. We got to be open to that, the complementary therapies. So potential side effects. So this is something that you should know about, and we should talk to our patients about: depression, dizziness, hallucinations, low blood pressure. There's withdrawal syndrome symptoms such as irritability and insomnia. So just because something cannabis has less than 0.3% or considered hemp, it still has certain side effects. So just be aware of that. It's not totally benign. Different types of consumption of cannabis. It could be eaten, it could be injected also, inhalation or vaping. This is just a little preview of this next slide. I put this up here because I know none of you know what any of this is, haven't tried it. So I want to introduce everyone to this. But basically, when someone calls a joint cannabis, cannabis is rolled in paper and smoke. That's called a joint. A blunt is you basically have empty cigars in which tobacco is replaced with cannabis. Spliff is a mixture of cannabis and tobacco mixed and rolled in a paper. A bong is composted cannabis smoked, drawn through the water. Vaporizer, cannabis is heated below burning temperature and smoked. And then hookah, there's a lot of hookah bars around, right? All over the country and world. Cannabis is mixed with flavored tobacco over charcoal, and smoke is drawn through the water. So, and there's a lot of variations of this. So just to be aware of that. Cannabis is usually smoked with larger and more prolonged inhalations than tobacco, usually smoked without a filter, resulting about 4 times the particulates compared to tobacco. There is no nicotine, which is good, right? That's a cancer-causing agent. However, smoking marijuana, it does share with tobacco. You have carbon monoxide, ammonia, hydrogen cyanide. Look at all these chemicals, right? Heavy metals, and there's not much data showing, because again, it's only been legalized for a few years, showing cannabis is associated with cancer, but it does have some compounds that are associated with cancer in it. So just be aware of that. It's not totally benign, okay? And there's 3 times more tar in respiratory tract in patients who've smoked cannabis compared to tobacco. So just be aware of that. There's higher rates, Dr. Tracy talks about asthma, higher rates of coughing, wheezing, sputum, hoarseness compared to the general population in patients who smoke marijuana. The rates of respiratory symptoms are comparable to tobacco smokers, and cessation of cannabis smoking reduces respiratory symptoms in some of the studies, the few studies that we have right now. So poll question, what statements are true about cannabis use and asthma? A, cannabis smoking can worsen asthma control. B, cannabis smokers have a lower prevalence of asthma. C, cannabis smoking reduces the need for asthma medications.
We'll just give everyone just a minute.
Yeah, exactly.
You don't have to make the Jeopardy noise if you don't want to.
Yeah, it's all good.
We'll just hold
I
there
can't
for just
sing.
a
What is it?
second.
Do, 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 do.
All right. One more, couple more seconds. Okay, so Dr. Nanda, what we have here is most 86%. Now it went to 83%.
Okay,
Said
some of them
A.
changed their mind.
They
Okay.
did. A, cannabis smoking can worsen asthma control. 18% and growing say D, all of the above. And for B and C, 1 or 0%. So please tell us what is correct.
Cannabis smoking can worsen asthma control, as we'll see. So marijuana smoking with asthma, right? So cannabis smoking is a risk factor for increased use and filling of asthma medications. Observational studies have shown an increased prevalence of asthma among cannabis and marijuana smokers. A precipitating factor for asthma is poor asthma control. So again, be aware of that. Discuss this with all our asthma patients. So again, it's not a totally benign thing, smoking marijuana, again, recreationally. So other lung conditions, it's not just asthma. There's so many other lung conditions that can be affected by marijuana. Bullous lung disease, COPD, emphysema, chronic bronchitis is associated. There's also an association, some case reports of pneumothorax or lung collapsing and acute lung injury. And interesting here with vaping, there's some case reports of vaping. We talked about vaping, and e-cigs, but vaping marijuana can cause an acute lung injury. They said combined tobacco, marijuana smoking increases risk of lung collapse. There's some mold potentially. The cannabis crops can get this mold aspergillus, which is one of the common kind of allergy molds out there. So be aware of that. There's some incidents of Legionella pneumonia, tuberculosis, even COVID-19 pneumonia. There's some increased risk of that, some case reports on that. Lung cancer, we're not sure about yet, but there are some reports linking it with it. And there's also some reports of increased cardiovascular risk, right? It's not just lungs and that's it. There's other parts of the body, right? There's other organ systems. So there is cardiovascular risk with asthma, some increasing reports on that. There's also this cannabis allergy. Any route of ingestion, smoking or edibles, rapid onset, it can affect the lower airways. Rhinitis is inflammation of the nose, conjunctivitis, urticaria angioedema. It's, fancy terms, right, for hives and swelling. And 20% of patients with cannabis allergy have experienced anaphylaxis, which is a severe form of allergic reaction affecting more than one organ system. For example, with hives, skin hives, and throat closure or respiratory symptoms. So just be aware of that. Adverse events versus cannabis allergy. And it's interesting, just as an allergist immunologist, itching is a lot of times what distinguishes a lot of times. If someone is just using cannabis, yes, they can have clear dilated vessels. We've seen that, at eyes, and nasal congestion, a little dose dependent increase in heart rate and blood pressure at times. But if you're allergic, a lot of times there's itching, eye itching, nose itching, mouth itching, swelling, hives. And it's interesting in patients who have had alcohol and NSAIDs, non-steroidal anti-inflammatories like ibuprofen, Aleve, those kind of things, and even on exercise, they're associated with, if they're predisposed to cannabis allergy, that can bring on an allergic reaction to cannabis. So just be aware of that there. Food allergy, right? So when people are allergic to foods, usually they're allergic to a protein in a food. And it's been shown, this was back in 2006, they identified peach. It has some of these, what's called a lipid transfer protein that's in cannabis and also in some of these foods, cereals, fruits. And so you could have reactions to that. So just be aware of that interaction there. And again, we talked about cofactors, exercise, ibuprofen, Aleve, alcohol. So if you're going to, partake in marijuana, it's best not to do it with alcohol, but a lot of people do that, right? They drink and smoke at the same time. That's just part of it. So it's good to educate our colleagues and patients about it. Be aware of this also, other cannabis related allergies, hemp seeds, just the seeds in itself, marijuana seeds. They're high in protein. They have, this omega-3 fatty acids. They're high in CBD, some therapeutic effects. So people are actually eating hemp seeds. And there are case reports that people have had allergic reactions to hemp seeds, and occupational exposure to cannabis. For example, if you're in law enforcement and things like that, you seize cannabis or illegal grows or cannabis, things like that, you can get sensitized and develop allergic reactions to being exposed to cannabis. So just be aware of that. There have been reports of people who are members of the police force actually becoming allergic, just handling marijuana, things like that. The challenges with cannabis, right? There's a lot of legal issues. There's adverse effects. And just to remind everyone, cannabis in commercial stores at your local dispensaries and things that you've seen, unknown amounts of THC, CBD, unknown purity. They're supposed to be regulated. Every state's different. But, I'm in Texas and there's not much regulation at all. So, if someone's saying this is CBD oil, it could have more than that 0.3% concentration, and it could be mixed with other substances. So just be aware of that for sure. Jimin, I think, seeing us, we're here to help, the board certified allergy immunology specialists, and we're trained experts, we're here at the college, of course, and work with us, but we're trained in all, allergies, asthma, skin allergies, sinus issues, immune issues, food allergy. So please come see us. And we work great with other colleagues too. All our other specialists, we're all colleagues, trying to help all our patients for sure. So talking to patients and each other about cannabis. So it's still federally illegal. Again, it's very depending on who you ask. But medical use is legal in 40 states. Recreational use is legal right now in 23 states. Again, states have different laws. Just be aware patients from states where cannabis is illegal may be less likely to be honest about cannabis uses. What Dr. Tracy was saying is, yes, you see a patient alone. There's incidences, of course, teenagers using it. And it's at parties, things like that. So that just be aware of that. And then check with each state's current laws on cannabis. I think talking to patients about cannabis and each other about it, I think the main thing is judgment, right? We all have our biases, we all have our judgments, unfortunately. And so I think coming from a thing of learning from each other, it's best to really, we want to learn from the history, and so we can help people, right? We can help each other out. So open-ended questions. You want to incorporate cannabis use questions with the same vigor as a history of tobacco and alcohol use. There's a cannabis intake form, which is published by one of the college journals, the Annals. Again, no judgments, active listening, and be open to learning about cannabis, right? Both the pros and the cons of it, and how and why people are using it. I think it's important to be open and honest about it. You want to adjust your questions according to patient preference and the tone. Leave time for questions. Answer questions as best you can. Take time to research patient questions and answers. And I think the most important thing, and being a physician, yes, we've been trained, we know a lot, but I still consider myself a medical student. I'm still learning, right? We're all still learning. So I don't know it's a perfectly valid answer. So I have patients all the time asking me different things. Hey, what about this study or that study? I don't know. So I look it up. I go, I'm not sure, but let me look it up and let me see. So again, we're always learning. So just be aware of that. And that's, again, why medical research is so important. And that's where we're fighting with the college and other allergy organizations to help medical research and to further help our patients. There's some cannabis education modules by the college, by the Allergist Foundation. There are 6 CME modules, on cannabis allergy, talking to patients about cannabis. So check that out. It's at the college website. And also there's the International Cannabis Allergy Collaboration, which I'm part of and the college is part of. I want to thank Allergy and Asthma Network. Again, an amazing, amazing association. You're really doing a great job in advocacy and really helping our patients, a great partnership. Of course, the college dermatology committee, integrative medicine committee. Again, the International Cannabis Allergy Collaboration was between the college, YACI, the European Allergy Asthma Clinical Immunology Society, and the Canadian Society of Asthma and Clinical or Allergy and Clinical Immunology. And Bill Silvers, he's my attending at National Jewish when I was trained there in Colorado, and he's done a lot of work on cannabis allergy and really complementary medicine. And so I appreciate that, Dr. Silvers. I'm the original Anil Nanda, so my email is just my first and last name at yahoo.com. So very simple. If you have any questions, anything, just feel free to email me, or if something comes up after the meeting, email me about anything. It's all good. And I don't know about all of you, but I feel pretty hungry after that presentation. So, and I'm sorry I didn't bring any samples, but yeah, I guess we have time for questions, or yeah, appreciate it. Thank you.
Thank you so much,
course.
Dr. Nutt. That was so interesting. We're
Sure.
seeing some questions come in. Let's start with one question from online asking about
Please.
CBD.
Welcome our online listeners, please.
That's
Absolutely.
right.
We're live. That's
Absolutely.
great.
Thinking about CBD creams.
Yes.
Do we know, how does that affect your asthma
Again,
conditions?
maybe not asthma, I think, but you can be sensitized to it because, if you're exposed to something, you could develop allergies to it potentially. So I think, the first of all, the creams, again, we don't know concentrations, but I think the thing is, if you're using something, tell your physician about it. So tell your physician about it, so at least they know. And if you're having any kind of side effects or any kind of symptoms, It could be the cream. We don't know. So that's for us to kind of tease out and help out. But definitely it's a route people are using, and we talk about smoking it, we talk about eating it, edibles, and definitely topical, and the cream is there too. So absolutely. Yeah.
Thank you.
Testing.
Question from the audience
Testing.
in the room. Linda.
Testing.
Yes.
Testing.
Sure. Did you want to do it?
Thanks,
all
Dr. Nanda. They can't hear you online.
I was just saying, we worked with Dr. Silvers a few years ago on some research projects, and he also did some webinars and some other things. So we ended up with a lot of educational resources about cannabis, and we get a lot of traffic to our website for people asking all kinds, is cannabis asthma? Is cannabis bad for asthma? It's just a whole gamut of things. People just don't really understand whether it's good or bad as far as their health condition. So I just wanted to let you know that we do have that information if you want to access it.
Yeah, I think that's a great comment, because again, with anything you use, foods included, there's positives and negatives. One of the most common medications is acetaminophen, right? That's the generic, the brand name is Tylenol. That can have really bad liver issues, right? Especially taken with alcohol. It's over the counter. People think, oh, it's very safe, but just be aware. Again, there's risks and side effects to everything. So that's why it's important to be open and honest with your physician or healthcare provider, practitioner, to say, what you're taking, how much you're using, so we can help you. Definitely, absolutely.
Got another question for you
Sure.
about secondary secondhand smoke exposure. Is that different than cigarette smoke? Is it the same? This person is living in a very fragrant apartment
We'll say
building.
that. Sure. Yeah. Yeah. No, I mean, definitely I think there's not a lot of studies on that like there's on secondhand, tobacco smoke, but yeah, I'm going to walk over here because I'm always on this side of the room. But yeah, I think there's always a potential possibility, definitely of inhaling and having lung issues. Just like smoking, we talked about different chemicals in marijuana and then smoking it. So it's definitely a potential risk, and it's again very hard to avoid, but you do the best you can. It's just like as an allergist, we say, I mean, no one's going to get rid of their pets, right? Someone's allergic to their cat, the cat's not going. They're going to get rid of their allergist first. But I say, okay, if you sleep with the cat in your bed, right? Because those who are allergic to cats know it, and they snuggle up to the patient, right? To their owners who are allergic to them. But maybe not sleep with your cat. Have your cat, if they have to be in the bedroom, maybe in a corner of the bedroom, have a nice bed for the cat away from the, so different grades of it to try and avoid that. But it's very prevalent, as that attendee was saying. Yeah, it's definitely out. It's hard to do. I mean, I was in Colorado for an allergy board meeting, and you could smell it. I went to a Denver Broncos game, and in Colorado, it was around. There's dispensaries on every block. Yeah. So definitely it's out there. But I think the more we know, the better.
Yes.
I think we have another question.
Back there.
Yeah, sure. It's all good. Yes.
So you can stay on.
Thank you. So, one of the things that I was thinking about when you were going over the difference between allergy side effects and cannabis overconsumption side
Sure,
effects
sure.
was cyclical vomiting syndrome. As we know, that can be triggered by cannabis overuse
Yes.
onset, but I also realized that it does have an association with asthma as well. How would you utilize that as a potential risk factor when talking with a patient, negotiating with them on?
No, I think absolutely. And it's difficult because sometimes anaphylaxis can present, severe allergic reactions with vomiting. So, and then again, that's a side effect, or whether it's a side effect or allergic reaction. But I think it's more, to just be aware that it can present in different ways. The just a side effect of the marijuana, and then having an allergic reaction to marijuana. But definitely, we see patients all the time, they're having more nausea, vomiting. It's important to ask. As physicians, we always ask about, tobacco, alcohol, but not a lot of people talk about marijuana or drug use. And again, there's a lot of judgment in there. There's a lot of issues. People don't want to get into it. They have their own personal issues with it. But I think it's important to ask and just keep in mind, patients, they don't present in one way. Not everything is like a standardized test question, right? They present in different ways. So I think it's something to keep in mind. Absolutely. Yeah.
Thank you so
Oh, no
much.
problem. Yeah. If you need anything, let me know. Appreciate it, guys. Thank you.